Hello and welcome to the program. I am Ogechukwu Ukekwe. The Nigerian Tobacco Control Alliance has called on the Federal Ministry of Health to provide a comprehensive update on the status of tobacco control funds amid growing concerns over the allocation, utilization and usage of funds for tobacco control. The Alliance made the call at a media briefing on the 2024 Tobacco Control Budget in Abuja. Chairman of NTCA, Akimbode Oluwafemi, emphasized the importance of transparency, saying that the National Tobacco Control Act stipulates that funds allocated for tobacco control in the national budget or from other sources are to be remitted to the Tobacco Control Funds account for utilization. He also emphasized the imperative of increasing funding for tobacco control in the 2024 national budget, underscoring the 10 million allocated for the costs in the 2024 budget when adjusted for hyperinflation. Oluwafemi urged the government to consider assigning tobacco tax as a source of financing tobacco enforcement efforts in the country. Pregnancy begins with a fertilized egg. Normally, the fertilized egg attaches to the lining of the uterus. An ectopic pregnancy, however, occurs when a fertilized egg implants and grows outside the main cavity of the uterus. An ectopic pregnancy most often occurs in the fallopian tube, which carries eggs from the ovary to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes an ectopic pregnancy occurs in other areas of the body, such as the ovary, abdominal cavity, or the lower part of the uterus. An ectopic pregnancy can't proceed normally. The fertilized eggs can't survive, and the growing tissues may cause life-threatening bleeding if it's untreated. We'll go on a short break, and when we return, we'll be discussing issues of ectopic pregnancy. Welcome back. Joining me to discuss further on the issues of ectopic pregnancy in women is Dr. Chiagozie Onuchukwu, ICU medical official. Thank you for joining me, Doctor. So as a professional, can you expand our knowledge on ectopic pregnancy as well as the early warnings of ectopic pregnancy or symptoms of ectopic pregnancy?
Okay, so ectopic pregnancy, in layman's terms, just means pregnancy that is outside the endometrial cavity or the endometrial cavity of the uterus. Okay, that is the place that houses the baby normally in the uterus. The uterus is what we usually call the womb. Okay, so when a pregnancy occurs or when implantation occurs outside this endometrial cavity, then you can say it's ectopic pregnancy. It can be in different places. It can implantation can occur in the cervix. It can occur in the fallopian tube. It can occur in the ovary. It can even occur completely outside the uterine or reproductive organ that is staying in the abdomen. We call it abdominal pregnancy. Okay, none of these pregnancies are usually compatible with life. So it means that with time, it gives its own problems and it needs to be attended to and taken care of. Okay, so that is a broad explanation of what ectopic pregnancy is. So when you talk about signs and symptoms of ectopic pregnancy, first of all, it's a type of pregnancy. It's pregnancy, the woman is pregnant. So there should be absence of a monthly period. So you have absence period, we call it amenorrhea. That is the first sign. The second sign is usually abdominal pain. So the woman starts feeling pain in the abdomen. Okay. And the third sign is usually bleeding. So the woman starts bleeding from the private parts. And when these three symptoms are there, it's almost always ectopic pregnancy. It's usually gives you are usually sure that the diagnosis is ectopic pregnancy. But you don't just stop there. You have to go a step further to, do an ultrasound, do a pregnancy test, do a better HCG levels and all to confirm that this is ectopic pregnancy. Okay. When you see these, when you suspect a woman has ectopic pregnancy, you don't really have to wait for these three symptoms to be there before start taking action. Sometimes some people do not come down with um, the symptoms completely. So that is also one of the reasons why we advise early pregnancy checks, early ultrasound scan in pregnancy. First of all, to confirm viability of the um, um, conceptus. Secondly, to confirm where it is. Okay, if it's in the uterus, if it's in the fallopian tube, if it's outside the uterus, if it's in the abdomen, you know, and then you plan the next line of action. So those are the three major symptoms of ectopic pregnancy. You can also see some other signs, like when the pregnancy is, getting bigger with baby movement, there is increased pain. Usually that occurs in abdominal pregnancy when the baby is completely out of the uterus, it's in the abdomen, it's in the abdominal cavity. So with movement, the mother feels much pain than she would normally feel, and when the baby is in the uterine cavity. So there are some people come down with flu-like symptoms, some people come down with excessive vomiting, but those are non-specific symptoms. Okay, but when you see a woman is pregnant, that is there is amenorrhea, there is abdominal pain, and there is vaginal bleeding, then it's almost always ectopic pregnancy.
So are there any risk factors or conditions that increase the likelihood of ectopic pregnancy?
Okay, yes, there are risk factors that can increase the likelihood of this condition. Okay, the first on the chart is anything that causes, because okay, usually the um, fertilization of an egg by a sperm cell occurs in the fallopian tube. Okay, when this fertilization happens, the movement of the muscles of the fallopian tube will push the fertilized conceptus down into the uterine cavity, the endometrial cavity of the uterus, and that is where the implantation takes place. So if you have anything that will alter this pathway of movement down, that is movement of the fertilized egg down into the endometrial cavity, it increases the risk of um, um, ectopic pregnancy. So one of the chief causes or chief risk factors is what we call pelvic inflammatory disease (PID). Okay, and it's just a big name for infection of the reproductive organ. I would say infection of the reproductive organ because it's as a result of an ascending infection, usually an untreated bacterial infection um, affecting the uterus or the uterine cavity and its surrounding. It can affect the ovary, the fallopian tubes, and the uterus as a whole. Okay, so when this usually this pelvic inflammatory disease causes, like the name goes, inflammatory. It causes continuous inflammation, and with continuous inflammation, there is scarring, formation of scar tissues. So that those scar tissues in the fallopian tube would cause an alteration in this pathway for the egg, so for the fertilized egg to move down into the endometrial cavity. Okay, so when that alteration is there, the possibility of that egg not moving down is very high. Okay, so that risk is there. It can also cause a narrowing because it's stenosis of the fallopian tube. So it narrows the tube. When it narrows the tube, the lies finds it difficult to move down to the endometrial cavity of the uterus. So PID is very important risk factor in the occurrence of ectopic pregnancy. The second is smoking. Smoking is also a very important risk factor in ectopic pregnancy. A lot of people do not completely understand how exactly it affects or how it plays this role. But research has shown that ectopic pregnancy is more common in women that smoke than women that do not smoke. Okay, another risk factor is increased maternal age. It's not an absolute risk factor, it's a relative risk factor for um, ectopic pregnancy. Then another important risk factor is the previous ectopic pregnancy. That is someone that has or must have had an ectopic pregnancy in the past is also at increased risk of having another ectopic pregnancy. So a previous ectopic pregnancy is a risk factor for another one happening.
So what would you say are the treatment options, the potential risks and benefits associated with each treatment option?
Okay, my treatment options, I would say we have three options available for treatment of ectopic pregnancy. One is conservative management. You want to, okay, I will list them and then I will explain them. One is conservative management, and the second is medical management, where you use medications, drugs, you will take care of it. Then third is the surgical management, the surgical approach. So first of all, by conservative management, just by the name, as the name goes, it's conservative because it's watchful waiting. You just watch and see how it goes. See if the body takes care of this ectopic pregnancy, meaning that it's in an abnormal position, and then you are waiting to see if the body will push it out on its own and then take care of it, and the woman is fine. That way, you don't need any intervention, no medical intervention, no surgical intervention. So, the benefit is that you allow the body to do it on its own. There is no intervention. There is no cutting this woman open. There is no placing this woman on medications that also comes with its own risk side effects. Okay, and the body, you allow the body just sort it out on its own. Now the risk factor or the risk that comes with this particular conservative management is that it can um, erupt into an emergency situation um, before you know it, okay, or unexpectedly. So, first of all, before you consider this conservative management, there are some things you have to check. You have to check, first of all, is this woman stable? Is she stable enough that you will just sit down and watch and wait and hope that the body takes care of it? Okay, normally you know that when the woman is not stable, you can't sit and watch. You have to intervene. So first of all, the woman has to be stable. By stable, I mean clinically, hemodynamically, blood pressure is normal, no temperature, no fever, no pain, no bleeding, nothing. This woman is normal. The problem is just that you did a pregnancy test that is positive, you do an ultrasound scan, and ultrasound shows that the pregnancy is not intrauterine, that is, it's outside the uterus, the endometrial cavity of the uterus. So, that is why. So, if you are leaving it for the body to take care of it, you have to also be monitoring this woman. This woman has to be coming in. If you do not admit her, you have to be coming in on a daily or twice daily basis for monitoring, so that you know when it has gotten complicated and when to intervene. Because when it gets complicated, it can happen real fast and it becomes a life-threatening situation. Okay, so you also have to educate this woman on the signs of possible complication. That's tell this man when you feel the slightest pain from this, when you feel slightest low abdominal pain or pelvic pain, you have to come to the hospital as soon as possible. When you see blood from your private parts or from your blood stain on your underwears, you have to come to the hospital as soon as possible because these are usually signs of rupture in ectopic pregnancy. So that is for conservative management. Medical management, you talked of medical management when we use drugs like methotrexate to take care of this pregnancy. Usually, methotrexate was earlier used for some other um, conditions, okay? But it was then found out that it's effective on ectopic pregnancy. It helps dissolve, it helps terminate the pregnancy and dissolves it so that the body will just absorb it or push it out, take care of it on its own. So um, now, currently, it is the preferred method of approach for women that are very stable. So, just like the conservative management, this woman has to be stable for you to do the medical management because the medical management also is just like watchful waiting, but you've given something and you are watching to wait the effect of this medication you gave or this drug you gave. And also, you have to, there are some other criteria, like being sure that there are no signs of rupture. You do an ultrasound, you confirm that this pregnancy is ectopic, you confirm that there is no free fluid in the cul-de-sac, which is usually a sign of rupture in ectopic pregnancy. Then you confirm also that this woman is hemodynamically stable. Okay, and even on the ultrasound, you also check for um, length, longest length of this conceptus. Usually, they say the books say that when it's 4 cm and below, you can go for, and the woman is stable, you can go for medical management. But above 4 cm, surgical management is usually preferred because there is increased rates of failure for medical management. Okay. So when you talk of the pitfalls, that is, yeah, pitfalls associated with this method, um, you talk of risk of failure. That it's a medical management does not mean it can't fail. You can do it and it doesn't work. The ectopic pregnancy still keeps going and then it progresses to a ruptured ectopic and then it becomes an emergency, becomes life threatening. So you also know that you have to be monitoring this woman as frequent as possible, okay, to know when there is need for an intervention. And by an intervention, I mean a surgical approach to it, okay. So the third management approach is the surgical approach. The surgical approach is either you do the one we call laparoscopy or you do laparotomy, okay. Laparoscopy is a minimally invasive surgery. That is, you don't cut the woman open and you are using your hands to look for the ectopic and then you try to milk it out or try to resect the section or the segment that is affected. You know, in laparoscopy, you just make like 3 holes in the abdominal wall, yeah, and put in your camera. You put in your cameras and the camera, the tube has some forceps that you can use to manipulate and then do what you want to do.
So how long is the recovery process after treatment of ectopic pregnancy?
Well, it depends on the treatment approach you use. Okay, if you do conservative management and the body takes care of it, I don't think there's anything like a recovery period. Okay, because the body goes back to normal, the normal monthly cycle comes, the normal monthly period flows, and all until the woman conceives again. Same with um, medical management. Okay, once it's taken care of, the pregnancy hormones drop, the fetal HCG levels drop, the usual hormones, the usual menstrual hormones or cyclical hormones come into play. The estrogen and progesterone, they do their thing and the cycle returns as usual. Okay. Then For surgery, once the surgery is not complicated, usually within 2 3 days, this woman is ready to go home. Okay, and when she goes home and she heals the wound sites heal adequately, and there are no complications. Within 4 6 weeks, this woman is back to a normal monthly cycle. The pregnancy hormones are down, they are undetectable, and the what's it called? If a woman undergoes treatment for ectopic pregnancy, whether surgical or medical, and then the normal monthly cycle does not return, or it's taking time to return, she does not see it 2 months, 3 months, 4 months, so up to 6 months, then there is a problem somewhere which she has to take a look at. Okay. Usually the recovery period for ectopic pregnancy is also long.
Okay, doctor, let's take a short break. We'll take a short break and the program will continue shortly. Welcome back. We are still discussing ectopic pregnancy in women. Dr. Chiagozie Onochukwu is still my guest. So, doctor, what would you say are the implications of ectopic pregnancy on future fertility?
Okay. So, first of all, ectopic pregnancy for a woman that has never had an ectopic before, he has one. Usually, what we do is we do a salpingectomy. Salpingectomy, that is assuming it's complicated, that is, it has ruptured and all. Usually, what we do is salpingectomy. Salpingectomy is that you go to you operate, go to the segment that the ectopic is, the segment of the fallopian tube that the ectopic is, and you cut it off. You take it out completely, together with the conceptus, that is the fertilized tissue. Okay, you take it off completely. Now you are leaving this woman with just one fallopian tube. Okay, and with just this one fallopian tube, this woman can conceive adequately. You can give birth to the number of children she wants to give birth to, and there will be no complications. Okay, but another thing is that if you leave this woman with just this one ectopic, this one fallopian tube, there is a risk of this one tube remaining, also getting complicated or also getting problematic, either from there's a risk of this getting problematic, either from continuous infection, like I said, PID, pelvic inflammatory disease, or even maybe it was problematic earlier before the ectopic pregnancy, and you took out the one that is fine, and then leaving this woman with the one that is not adequate for conception. Okay, so in that way, it can also affect the conception for this woman. Secondly, for a woman, let me still maintain this example. If a woman now, she has just one fallopian tube, and she now has another ectopic pregnancy in the remaining fallopian tube, what do you do? Do you go in and take out the remaining fallopian tube and make this woman barren? No. In that case, we now favor the salpingostomy, except when this ectopic is now complicated. Maybe it's ruptured and it can be salvaged. Okay, but normally, all things being equal, we favor salpingostomy in this case, which is where we just make a slit on the fallopian tube and try to take out the ectopic pregnancy and maintain the quality of the fallopian tube. Okay, when you do this, there is no guaranteed or there is no guarantee, remaining fallopian tube. Okay, there is absolutely no guarantee, but there has been success cases where it's done and this one is still conceived. Okay, but there is also a risk of her not being able to conceive again. So yes, that is how we can play a role in future fertility.
Well, Dr. Chiagozie Onuchukwu, ICU medical official, thank you for lending your thoughts. Okay, that's all we can take on this episode of the program. Thank you for watching. We'll see you next time. Bye for now.